Hi, I'm Dr. DeFabio, and today we want to talk about lifestyle management and specifically cholesterol. What's your number? I don't know. I mean, I'm 220. Oh, I'm 180. Oh, I'm 110. I don't care. I really don't, okay? What I care about is what type of cholesterol you have. Do you have inflamed cholesterol? Do you have sticky cholesterol? Do you have cholesterol that wants to create plaque and irritate your blood vessels and cause them to narrow? That's what's going to give you cardiovascular disease and hardening of the arteries. Do you have cholesterol that's kind of loosey, fluffy, and doesn't want to stick to anybody and wants to do their own thing, kind of like being a hippie, right? That's good cholesterol, because that type of cholesterol will not lead to plaquing. But let's talk a little more traditionally before we go into the hippie concept. You have your HDL cholesterol, your high density lipoprotein cholesterol. That's called your good cholesterol. Why? Because high levels of HDL by research have been shown to reduce your risk for cardiovascular disease. That's why they call it good cholesterol. Then you have your low density lipoprotein and your LDL, and then you have your VLDL, your very low density lipoprotein, and then you have your total cholesterol number, right? The LDL is called your bad cholesterol because that makes you more at risk for cardiovascular disease, theoretically. No real research that shows that, okay? What you want to make sure of, though, is if your LDL is inflamed, that's a problem, okay? If it's sticky, all right? So how do you know if you have sticky cholesterol? You have to look at your particle size, all right? Your particle size determines how dangerous your cholesterol levels really are, all right? So particle size, small tiny particles, think of them like a BB. Think of them like a high-powered rifle. They're going all over the place and they're looking to cause trouble. Big, fluffy, large cholesterol, they just kind of float around and hang out. Those are your hippies. That's what you want. How do you get big, fluffy cholesterol? You have to have good fats. Omega-6 fatty acids in your diet are bad fats, so get them out. You want your omega-3s, your fish oils, your gamma-linolenic oil from flax, from hemp seed. Those give you big, fluffy cholesterol, and you gotta stay away from white sugar. White sugar and omega-6 fatty acids make tiny cholesterol particles. Your total number, it's based on you, all right? But it also is based on how much of that is good, fluffy cholesterol and how much of that is sticky, tiny particle LDL cholesterol. Hey, your particle size is also indicated with your HDL. You want fluffy HDL too. So look at the ratio of your HDL to total cholesterol. That's a good indication if you're at risk for cardiovascular disease, because the average American that dies from cardiovascular disease has an average cholesterol ratio of good to total of 5 to 5.1 to 1. So get that low. If your ratio is 3 to 1 or even less, guess what? You're not at as risk compared to everybody else in America. So there's some tips on cholesterol. From my perspective, if I know what your particle sizes are and the ratios of the good to the bad and your VLDLs to your LDLs and your APO ratio and all those other ratios, then I know what supplements to recommend, because different supplements do different things. Do you want to get those LDLs into a good range? Yes. But more importantly, you want to make sure that the cholesterol you do have is fluffy, wants to hang out, and wants to be friends, but doesn't want to stick and create hardening of the arteries. So there's your primer on cholesterol physiology. I'm Dr. DeFabio. It's Healthy Heart Month. Hey, save somebody's life. Share this information. Have a great day.